Hi, welcome to Functional Fridays. I'm Dr. Sherry Jacobs, naturopathic doctor, certified nutrition specialist. I'm with Dr. Shannon Kennedy, internal medicine doctor. Today we wanted to talk about something that is, in our mind, 100% preventable, and that would be type 2 diabetes.
Yes, yeah, it is one of the most common diseases that we see, and we often see it in conjunction with other diseases. So I don't think I have any patients that just have type 2 diabetes. They often have high cholesterol and high blood pressure. They're often overweight, but I have many skinny fat people that have type 2 diabetes and they're very slim on the outside.
And it often goes a long time undetected for that reason.
Right,
Yeah.
right. Those are the people that we catch them later on, and they already often have cardiovascular disease and other things. The reason why type 2 diabetes is so important to talk about is because it's the main cause of the things that are the leading cause of death in our country, right? So people die of cardiovascular disease, and that's very often related to type 2 diabetes, or even the pre-diabetic state or insulin resistance, which we can detect decades ahead of time.
Decades.
So,
And it's not, you're not going to really detect it with a fasting blood sugar. That is not, by the time fasting blood sugar is elevated, you've missed the boat, so to speak. Not that we can't come back from it, but you need to have other measurements done, more preventative types of labs done first.
Right.
Over the years.
So when we see a new person that's interested in staying well, even though it's not necessarily indicated, insurance might necessarily cover it. We do check fasting insulin levels on people, and it's good to get a baseline hemoglobin A1C, which is an average. It's a number that averages what your blood sugars are over a 3-month period, and it gives us a place to start from. So if you're 25 and you have a family history of type 2 diabetes, cardiovascular disease, it's a good idea to know those two numbers, to know your fasting insulin levels and your hemoglobin A1C. And they're not very expensive to check. So we just get that done, and we can say, you're in good shape, and we'll check in again on that number, if anything changes or as you get older. But a lot of times we do detect young people with elevations because of the standard American diet, and they look fine and they feel fine and their number's high, and we can intervene then before disease develops.
Yeah, and part of a good healthy aging protocol is really looking at those numbers, because one thing that's actually appropriately named in medicine is AGEs, which are advanced glycation end products. And so that is something that actually ages us when the sugar molecule attaches to the protein, and it changes some of the structure of your things like your skin and your eyes, and it visibly ages us, and internally it ages our organs and our cardiovascular system. So, so yes, it's part of a good healthy aging program to look at these things and get them measured and follow them, and then look at the underlying cause. Often it is related to diet and exercise. It's often related to environmental toxicities and nutrient deficiencies. There are certain people that just need different nutrients or different amounts of nutrients, and sometimes that's how we find it out, is through some of these labs that are abnormal.
Yes. In conventional medicine, I was trained that once blood sugar gets over a certain number, we look and we check the A1C, and then we put you on medication. But then the damage is already done. And so we practice looking for it far ahead of time so that we can prevent those diseases and help keep you looking younger too.
Thank you.
Yes, thank you.